Welcome to the Preceptor Module 1, Roles and Relationships. And this Preceptor Module is brought to you by the Montana Center to Advance Health Through Nursing, or the Montana CON, the Academic Progression in Nursing Grant, the APIN grant, funded by the Robert Wood Johnson Foundation. The Montana CON is the official state action coalition of the Future of Nursing campaign for action in Montana. And co-leaders are Casey Blumenthal, Vice President, MHA and Association of Montana Healthcare Providers, and Cynthia Gustafson, Executive Director of the Montana Board of Nursing. And I'll go to this website right now and just show you the Montana CON website. And this is where you can receive a lot of information about webinars that the APIN grant and the Montana CON are putting together to inform nurses around the state. And so I would just mark this montanacon.org website and like us on Facebook and go here often to find out the kinds of things that are going on around the country. My name is Sandra Kuntz, and I'm a member of the faculty at Montana State University and the co-project director of the APIN grant. And I'm pleased to welcome you to this first webinar for preceptors. I will say that many of you are seasoned preceptors, and so this will be this first module, and maybe the second one will be a review, but I hope you will find some information, some new information also. So the purpose of the 5 modules in this series is to enhance preceptor effectiveness and satisfaction with a precepting experience. Studies by Henderson et al. 2006, Parsons 2007, and Burns and Northcutt 2009, and Duteau 2012 suggest that educational offerings improve preceptor self-efficacy, confidence, effectiveness, and satisfaction with their role as a preceptor. Criteria for successful completion of this webinar include attending the entire webinar for Module 1, takes about an hour, reading the assigned chapters in the Ulrich 2012 book, and then affirming completion at the end of the module when we send you the link to the evaluation, and completing that evaluation at the end. And again, we will send you a link that will allow you to evaluate the modules and give us feedback. At that point, you will be given an opportunity to say that you have completed the reading, and you will be awarded the contact hours associated with the webinar. In addition to this module on roles and relationships, there are 4 more modules. Module 2 covers communication, Module 3, learning styles and teaching strategies, Module 4, planning a precepting learning experience, and Module 5 is related to evaluation. Although we are bringing you the latest evidence related to preceptor practice, we don't believe we will raise all the questions you might have or answer all the questions you might be thinking of. For this reason, we have created a password-protected blog or a discussion board for modules 1 through 4 with 1 contact hour per module awarded. This space, if you decide to participate, and we certainly hope you will, is provided for your reflection and application of the precepting experience and is an opportunity to share some of the valuable experience that we know you have. So we can present information and you can do wonderful reading, but it is your actual experience that we value so very much. There is no conflict of interest of any of the planner or presenters involved in this activity, and the contact hours are provided by the Montana Nurses Association. You can see that information at the bottom. So the objective of Module 1, to define roles and relationships critical to preceptor success. Your success and satisfaction as a preceptor impacts, first of all, you, because we want you to be a satisfied and effective preceptor because you make a lot of difference in your healthcare organization that you represent, the students or new grad or new employee you precept, and in the case of students, those very students we have in your organization to learn the nursing role. And of course, your effectiveness also will affect the next generation and the patients that will be served by you and the students and the people that you will precept. So we have a number of inquiry questions. First of all, the inquiry questions are, some of the things we might ask. How do current national initiatives and the Montana and National Board of Nursing rules impact and enhance the role of the preceptor? What competencies are essential for preceptor practice? What are the roles, responsibilities, and relationships necessary for a dynamic preceptor, preceptee, and faculty partnership? What is the role of the preceptor as a coach? And what coaching strategies inspire growth and development of the preceptee? In terms of context, RNs are the largest sector of the healthcare workforce. We all know that. What do nurses do? We diagnose and treat the human response to actual or potential health problems. And we involve individuals, families, communities, and populations. We're involved with prevention, health promotion, health protection, and alleviating suffering. And we are advocates. This information is from the ANA Scope of Nursing Practice 2012. According to the ANA in 2011, the average age of employed RNs is 45.5 years, with 45% of RNs 50 years older. In July and August of 2009 Journal of Health Affairs, Bierhaus et al. Found that despite the current easing of the nursing shortage due to recession, the U.S. nursing shortage is projected to grow to 260,000 RNs by 2025. There is a critical need in Montana and nationally to attract, prepare, and retain nurses once they are licensed and employed. Early results from the National Councils of State Boards of Nursing, the Transition to Practice Survey 2013, found that new RN graduates who had a primary preceptor during their first 3 months of employment practiced at a higher competency level with fewer errors and were less likely to leave the profession than unprecepted grads. So this is what we know. Precepting matters. In terms of rationale and support for preceptors, I'm going to speak briefly about the support for preceptors provided by the National Council of State Boards of Nursing and also the Montana Board of Nursing. According to Ulrich, on page 2 of your reading, preceptors need to be grounded in, first of all, the ANA Code of Ethics and the standards of practice and professional performance. The scope and standards are the authoritative statements of duties that all RNs, regardless of role, population, or specialty, are expected to perform competently. These standards provide the basis and rationale for our role as teachers and preceptors. So the standards of practice, the ANA codes of nursing. The reading in Ulrich also provides a quick overview of 4 Institute of Medicine reports that identified areas where nurses could contribute to the reduction of errors and improvement in quality and safety. The AACN, they're the Quality and Safety Education in Nursing, CUSIN competencies, and then the AACN Essentials, as well as the American Academy of Preceptor Advancements, establish core knowledge and competencies necessary for professional practice. This is American Academy of Preceptor Advancement is a very valuable resource, and I'll be guiding you there to a website just very shortly. So here is National Council of State Boards of Nursing. This is their transition to practice on their website. They look at education, service, and research and through collaborative leadership, and they see what really new nurses, students, individuals who are transitioning to a new role, who are nurses but are transitioning. This website and the study that they have done has been quite valuable for providing feedback to us in rural areas and in urban areas across the country. And I just want to point out this second resource, the Montana Board of Nursing Administrative Rule 24.159.665, that establishes that preceptors in nursing education, first of all, clinical preceptors may be used to enhance but not replace faculty-directed clinical learning experiences. And the second point, a preceptor's utilization is limited to no more than 20% of a student's total clinical hours, and that's any pre-licensure program. So those nurses that some of you will precept that are RN to BSN students, those are post-licensure folks, and this 20% rule does not apply, nor does it apply to graduate students who are precepted. But in this, at this place, this administrative rule document, you can see the role of the faculty also. So we have a number of IOM reports that I've referred to and are well documented in your reading in the Ulrich book. So I wanted to take you just for a minute to the Houston website. And many of you will be well aware of this, the Quality, Safety, and Education for Nurses website. And this is a valuable place. You can see many of the competencies that are required and are being very carefully followed across the country to improve quality and safety for patients. Of course, this is a big emphasis in healthcare today. So let's go back. The other document, I think we probably all, everyone, if you aren't familiar with the Future of Nursing document, the IOM report that really highlighted nursing and the roles that we all play and where we'll be going in the future, I really recommend accessing this. It's on the web. There's a PDF document that you can download. Looks like that. So one other very important resource in terms of competency are the scope and standards of practice. And the American Association of Colleges of Nursing has a website that highlights the essential series for bachelor's, master's, and doctoral level. You may all be familiar with this, but it's also a good place to see what, if you're working with a bachelor's level student, what they might minimally require, what they would be doing, what they should be accomplishing along the way. Faculty across the state watch the essentials very closely as they prepare curriculum. So it's good to know where that information comes from. And then the second resource is the American Academy of Preceptor Advancement. This is a very valuable resource, and I'll go to each of these websites, where you can look at the competencies required for being a preceptor. You can also be certified as a preceptor just by taking continuing education credits like you're doing right now. And if you, let's see, I think what I'll do is go to this website and show you both the AACN. There's the Essentials series, and you can see that the Essentials Baccalaureate Education for Nursing Practice in the toolkit. You can download this for free. Here are the Master's Education in Nursing, and that's available, and there are also the doctoral education. So this is a valuable resource for you to know about. The other website I'll just show you quickly, the American Academy for Preceptor Advancement, is also available, and I have recently just learned about this tremendous resource. They have a lot of information available for people who are precepting, and I'm hoping that as a state, Montana can associate more with this Academy for Preceptor Advancement. Really some wonderful material, but you know, we won't take the time to look through that right now. We'll just keep going. So if you want to take just a moment to think about how you have used or might use these documents as you precept students, you might make a note of an instance of how you have used in the past the ANA Code of Ethics or the Standards of Nursing Practice. How did these resources help provide rationale as you guide students and explain to them why you have chosen a particular action? What is behind your decision making? So in the blog, which I hope you all will participate in, just having a discussion together, you might describe the value of the documents to your practice and role as a preceptor. So just in terms of your reasons, I'm wondering why you decided to be a preceptor. And I have talked to a number of people in reflecting about this. Some say that they want to serve as a role model to students or to new graduates. Some say they want to give back to the profession that they have been a part of. For me, it's been over 45 years. It's been a wonderful experience of being a nurse, and I want to share it with all of the students, the young people coming forward. And I think it's so valuable to have the experience of having my colleagues in practice participate in their learning. Some say the reward, they just are rewarded by knowing you have helped a student or a nurse succeed. Some say, I want to prevent a pass, sink, or swim, throw you to the lions experience. And I think we've all been thrown to the lions once or twice in our lifetime. And it isn't particularly, some of us survive despite it. And I guess that's one way of growth occurring. But some of us would rather have people learn in a positive way. And being thrown to the lions isn't necessarily positive. Some say just for personal growth because they get a lot out of being with students and they learn a lot from students. I certainly do. Every time I'm with the students I work with, I learn more than I teach sometimes. There are other reasons for being a preceptor, and just pragmatically, professional gain, the clinical ladder advancement, role enhancement, additional compensation even. And we're seeing that around the state, that some preceptors at some critical access hospitals are rewarded with extra compensation. And some of the hospitals are thinking about this and doing this because it's such a valuable role. So in terms of a definition, precepting is an organized, evidence-based, outcome-driven approach to assure competent practice. And that's from Ulrich, the very first page, page 1. Preceptors are individuals that have demonstrated competence in a specific area who serve as a teacher coach, leader influencer, facilitator, evaluator, socialization agent, protector, role model to develop and validate the competencies of another individual. That's also from Ulrich. Parsons, 2007, says an experienced nurse, preceptors are experienced nurses who develop a one-to-one, time-limited, often voluntary relationship with a nursing student, providing guidance and supervision to promote clinical competence and skill development. So in terms of history, we believe that the preceptor model started in nursing in hospitals and clinical agencies in the mid-1970s. And of course, this model has been out there for a long time before this, but they think that they've been able to trace it back to Marlene Kramer, who worked on reality shock. And for beginning practitioners and with Patricia Benner's novice to expert model, it was about this time, the 1970s, 1980s, where the preceptor model really gained in prominence across the country. So the value of the preceptor, of course, students, first of all, bridge for students, the value of the preceptor is to bridge theory to practice gap, because we know we can only do so much in the classroom. We have to get out in the clinical practice setting. For students, the preceptor helps achieve planned learning outcomes. They help improve skills. They help reduce anxiety, and they enhance rapid role socialization. As an academic institution, we believe as faculty that preceptors enrich the overall educational experience. We have no doubt about that. And of course, you often provide the capstone that students need before they enter practice. For an organization, you're valued because of the you link potential new employees to your organization. And this is something that Tim Orcutt is going to talk to us about. I'm going to bring up a video clip that he has developed a message, and be sure that here it is. And so he's going to talk to you about why North Valley Hospital has invested in the preceptor model.
Hello, my name is Tim Orcutt, and I am the Education and Training Specialist at North Valley Hospital in Whitefish, Montana. I wanted to briefly explain the benefits of our preceptorship program. We have implemented a preceptorship program which recognizes nurses with superior clinical skills, trains them, and also rewards them for their time. We have recognized the importance and the contributions a well-prepared preceptor can have at our organization. They provide new employees with a first impression. We want first impressions that result in long-term relationships, not just a single date. We also recognize the difficult world nurses face every day. We ask them to do more and more with less time. This also holds true to orientation programs. A well-trained and prepared preceptor can ensure the best training in these environments. They do this by assessing competency and developing goals and objectives. They learn to do that in preceptor programs. Our preceptors are providing leadership, mentorship, counseling, clinical expertise, socialization, and education. These are not attributes or skills easily possessed, and they take development and teaching. And these are done in the preceptor program as well. Our program has resulted in improved onboarding of new employees, improved turnover, lessened orientation times, and most importantly, improved competency. Nursing students, recent graduates, and other nurses have recognized North Valley as a leader in healthcare and a place where many of them will look to start their career. We contribute this to our preceptorship program. Hello. My name is Tim Orcutt, and I am the Education and Training Specialist at North Valley Hospital in Whitefish, Montana. Hello.
Sorry about that. Didn't quite. That was on a loop. So, okay. So, Tim really does a wonderful job of making us aware of the value to organizations. There we go. And he described the various roles, and we're going to go through each of these roles with a little more detail and talk about what you're doing in all of these roles. And if this seems daunting, it is daunting to think about what you're contributing to the individual who you are working with. This is a model that I really liked. It was from the Elsevier Mosby Preceptor course that I recently looked at, and I want to be sure and give them credit. They have successfully integrated all of the teacher, coach, evaluator, and educator, the facilitator, the role model, socializer, and team leader, and then the protector, the safeguards patient and the preceptee. And we know how important those roles are and what you are doing for the student or the new grad that you're working with. In terms of a teacher coach, Ulrich on page 8, and Orling and Hallberg, 2000, say that creating a space for learning and providing concrete illustrations, providing control over the opportunities and pace of learning, and allowing time for reflection is very critical to the teacher-coach role. There is a 5-step 1-minute preceptor tool that Curtis 2007 has developed, and I would like to show you that very briefly. What I'll be probably talking about this in future modules because this is a way of first of all, just presenting information and working with an individual in a fast-paced unit where you don't have a lot of time to do a lot of teaching, and so you want to first of all get the commitment of the individual, probe for supporting evidence, teach some general rules, reinforce what was done right and correct mistakes, and those are the 5 steps, and it goes very quickly. And if you think about ways that you have worked with students in the past or new employees, sometimes that's a very effective way of doing something very quickly. So I'm going to see if I can bring this video up. It is on this website, and by the way, I want you all to know that I'm going to link you all to our Dropbox, a very particular place where you can get all the notes from my storyboard that I've been working from today. It will have all these links, and you can go back and review and look at this in the future. So you will be able to link to this. So let's see what this fellow is doing.
Try improving your teaching skills with this classic 1-minute preceptor technique. So what have you got there?
This is a 45-year-old woman who fell down 3 steps, and she landed on her right outstretched hand. She had some pain and swelling over the lateral part of her elbow when I examined her, as well as some pain over her distal radius. Her elbow flexion is also decreased, and she has pain.
Okay, so what do you think is going on here?
I think she just has a simple sprain of her elbow and wrist.
Okay. Did you think about anything more serious?
Well, I looked for fractures on the x-ray, and I didn't see any fractures of the elbow or the wrist. And when I palpated over her snuff box, she didn't have any pain or tenderness, so I think a scaphoid fracture is quite unlikely.
What we'll do is we'll go and take a look at the x-rays, and when we do, I want you to take a good look at the lateral view of the elbow and look for a sale sign. So you see that when the fat pad's elevated by intra-articular hemorrhage, and that sometimes can be the only sign of an occult radial head fracture. So let's go take a look. You were right to think of a fractured scaphoid with that mechanism of injury, but I think with the lack of tenderness and the normal x-ray, I think that rules it out. But I do think she probably does have a fractured radial head. If you look at this sale sign here, you can see the elevated fat pad. And even though we can't see a fracture on the radial head itself, we can infer it from seeing that. So I think we should treat her for that.
Okay.
So we'll go back and see her.
Sure.
Okay, so that was obviously a physician to an intern or a resident, but we definitely could probably make our own YouTube video of the 1-minute preceptor example from your experience. How can you use that technique to bring people along, be very positive, and develop that person and their level of knowledge? So everything in nursing is developmental. We constantly develop and learn over our lifetime. And as we work with students, just keeping that that in mind of how do you go about coaching and teaching. You know, one thing I would say is that often we think of the teacher as the sage on the stage, and the coach is more the guide on the side, the person that's encouraging, asking questions, seeing what somebody knows, giving them credit for what they do know. So in terms of a definition, one definition, and it's found on page 121 of your reading for this module, helping others find the answers within themselves, tapping their own wisdom, passion, perseverance, and strength, gaining understanding and meeting within their circumstances, and taking action to move through a challenge. And so the coach really helps guide and encourage and brings out what someone may, I know when sometimes we send students the first time they ever go to clinical, they are just terrified. They say, I don't know anything. I'm pretty sure I'm out of place. And it takes a little bit to make people relax and realize that you really do have a lot of skill and you really are bringing a lot. And so let's just, let me just give you time to take a breath and realize that you are very skilled and have a lot of ability. So one of the ideas of the blog is, in your role as coach, perhaps you can give some examples of strategies from this module that you have applied, or things that you have learned to do to inspire a preceptee to move beyond a specific challenge. So those behaviors and beliefs and coaching strategies are what we would like to capture eventually. Another role is the leader influencer, and I really like this quote by David Lynch: "Authentic leaders are not made, nor are they born. They are enabled or disabled by the organizations in which they work." So leadership is an expectation of all registered nurses, and that's from the ANA 2010 document. Nurses lead and influence through application of professional values. So those professional values include altruism, or a concern for the welfare and well-being of others; autonomy, or a right to self-determination; human dignity, respect for the inherent worth of all individuals and populations; integrity, we act in accordance to our code of ethics and standards of practice; social justice, providing fair treatment; and diversity. Preceptors are also facilitators. So if you are facilitating a learning experience, that opportunity comes from a clear understanding of the level and expectations of the experience, and what are the specific clinical objectives and clinical competencies that the preceptee should achieve. What experiences are needed to facilitate and plan a learning experience, and we're going to talk about that in future modules. So another role is a socialization specialist, and Henshaw says socialization is the process of learning new roles and the adaptation to them, the process of becoming a member of a social group. Formal and informal expectation, unwritten rules, and the norms and taboos, all of this transition from the individual in a social role to the professional role. And of course, you are all very important, as are nurses everywhere, in bringing people along and encouraging them into the role of the RN in a practice setting. So another role of protector, and I don't know who took this picture, but I certainly hope that that mountain goat made it through this experience. So what we're attempting to do as a role model or protector is help people understand and demonstrate competence for adherence to standards of practice. So creating a safe environment for patients. Preceptees, they learn to ask questions, and they're actually protected from lateral or horizontal violence in the workplace. And This is hard to even imagine, but I just received from the Institute of Safe Medication Practice, ISMP, a study was done 10 years ago. They conducted a national survey regarding intimidation in the workplace. And the results showed that disrespectful behaviors were not isolated events. They were not limited to just a few practitioners. They involved both lateral, peer-to-peer, and interdisciplinary staff, and not just physicians. They involved both genders equally. So 10 years later, they resurveyed health professionals only to find that hostile work environments in which disrespectful behaviors continue to erode the professional communication still exist and are very critical to patient safety. And so I think that this is one of the ways that the preceptor is so aware of the protecting the preceptee, who is a very vulnerable. And one of the ways that Modick and Schleusler describe this process is just being alert to behaviors, be aware of the vulnerability of the preceptee, model professional behavior, and help preceptee name behaviors and learn how to speak up. And of course, we're all responsible for creating healthy work environments. So in terms of evaluator, there are just a number of questions. What are the criteria-based competencies expected of the preceptee? What is the preceptor role in evaluation? What approach do you see in providing constructive feedback? And what improvements are expected? And these are all things we can talk about in the blog, but you really want to clarify with the individual that you're working with, the school you're working with, the faculty you're working with, what is your role as the evaluator? In terms of preceptees, the preceptee is either a pre-licensure undergraduate from an Associate of Science nursing program, ASN or an ADN program, a generic BSN program, an accelerated BSN program, or a diploma program. And of course, we don't have any diploma programs in our state, but we do have accelerated programs, generic BSN at both MSU and at Carroll College, and of course, a number of wonderful associate science nursing programs around the state. So there are also, the preceptee might be a licensed RN to BSN student, and many of you will be working with people at Salish Scootney College or Montana Tech. Northern, MSU Northern has an RN to BSN program. And so these are post-licensure folks that also are preceptees because they're coming back for a new role, the BSN role. They might be a licensed RN graduate student in a master's or doctoral program, or they could be a new RN graduate that is new to the workplace, or and a new employee, someone that has come from another state and has never worked in a rural critical access hospital, for instance. So you might encounter a preceptee with any of these definitions. In terms of the value of the preceptee, of course, for us, an individual, this is an individual with wisdom, interest, and capacity to learn. They are an adult with valuable lived experience, insights, insecurities, and needs. They are the next generation. They are our soon-to-be colleagues, and they could be our future caregivers. And if you've ever had the experience of having to go to the hospital for care, one of the most gratifying but humbling experiences I've ever had is the fantastic experience I had a couple of years ago of being cared for by people that I taught. And I was so proud of what they did and how they provided care. It is both humbling and gratifying to have that experience. So what is the purpose of this experience? And this is the the question that has to be asked each time you receive a preceptee or agree. How would the preceptee describe the experience? What does the faculty say about it? What is supposed to be accomplished during this time? What are the goals and the competencies that the preceptee expects to gain with this experience? What kinds of things must the person accomplish in order to move on to their next, either the work that they're going to do independently or with a team? So one of the questions I think it's important to, it's just very important to define the faculty role. And the Montana Board of Nursing Rule 24, the one that we just looked at, says when utilizing preceptors, faculty members are responsible for, first, ensuring safe, accessible, and appropriate supervision based on client health status, care setting, course objectives, and student level of preparation. They're responsible for selecting the individual preceptors and ensuring appropriate preceptor qualifications and scope of responsibility, ensuring the preceptor demonstrates competencies related to the area of assigned clinical teaching and will serve as a role model and educator to the student. And fourth, the faculty's role is to provide the theoretical basis of the laboratory portions of the course. And I would add that it's very important for faculty to communicate frequently with preceptors. So the preceptor shouldn't feel alone. They should feel like they're connected to an individual. This is a preceptee, a preceptor, and a faculty member. And that's the team. And then the organization, there's an expansion of that team beyond. The value of faculty, the first thing you should think is that this is the resource I need. They hold the goals and objectives that this individual is supposed to be bringing to this work site. And so you want to constantly refer back to them and gather information from them. So I wanted to bring you a message, and I think I would love to talk to you if you would be willing to give me a video clip of what your experience is, and maybe recommend a faculty member that you believe is a great faculty member partner with you. And so I know of an individual, and I asked her if she would talk to me about what her role is as a preceptor. So I am going to have you meet Sharon Andros.
Hi, I'm Sandy Kuntz, and this is Sharon Andros. And Sharon is a faculty member who teaches in a precepted course. That's and right. So, Sharon, I just wanted to have you describe your role as a faculty member in this precepted course. What is your role and how do you communicate with faculty?
Okay. First off, I'd like to say that I really enjoy having preceptors and working with the faculty, with the students and the preceptors. I think it's a real good marriage. Also, I think communication is the essential tool to have a good relationship with that preceptor before you place the student with that particular preceptor. What I usually do, because I do 487 Leadership and Management course, I communicate with the student prior to the start of the course to find out what their interest areas are. And then I try to choose the area. I have them give me three and prioritize those. And then I look at which preceptor I think will match that student the best. What's their style? How do they communicate effectively? And whether or not they can mesh. And sometimes if I have a student who's super anxious and super organized, and I'll place them with the manager who is really calm and slower paced, and so that they can modulate that some for the student.
So how often during a semester would you communicate with a preceptor? I
communicate real frequently. I meet with the preceptors first and indicate whether or not they are interested in that semester having a student. So I get that cleared up first. If they say they are interested, then I proceed and I send them the packet, the preceptor packet, and I make sure they have the syllabus, the course outlines, all the evaluation forms, everything that they have. And then I meet with my student, and I have the student put together their resume and a cover letter, so they have that in place when they meet their preceptor for the first time.
Good. Great.
After that, I go with the student to make their first contact. And I think that's really important, as I think it sets the tone for the whole semester. So then the student can ask questions, the preceptor can ask questions, we're all on the same page. So I meet with the student and the preceptor together.
Okay.
Then I communicate with that preceptor frequently throughout the semester. I do that via email, and I also make visits. I personally go over and talk with the preceptor to find out how everything is going. Is there anything that they need from me? Do they have any concerns in relationship to the student? Is there anything that they need from me that would be helpful in their preceptorship?
Right. Right.
And then I'll do that with the student also.
Good.
To find out. If the student's having a difficult area with the preceptor, I meet individually with the student, find out what that particular situation is, and then I will meet with the preceptor and see what their perspective is of the situation. And if necessary, then I'll have the three of us meet together and look at what we might be able to do to resolve that conflict.
Thank you. Thank you very much.
Mm-hmm.
So that is one example, and Sharon Andros is just an excellent preceptor, faculty member rather, but she's also been a preceptor. And I think that she described her role, but it's very different. Every faculty member has a little different challenge. You may be working with a faculty member that is at a distance, and so it may not be that you'll have all those visits, but you should have contact. I think the main point here is that you should be hearing, and we need to know if you need more or less, and a lot of times your feedback let me have just some time with a student, let me see how this develops, and then I'll be in touch with you. So that's just great communication. That's the kind of that's exactly what we need in order to have a positive experience for a student. We appreciate that kind of feedback. So in summary, we have, if we can get this back, a little slow. There we go. So we have actually discussed national initiatives and the Montana Board of Nursing rules that impact and enhance the role of the preceptor. We've located the competencies essential for preceptor practice, the AACN Essential Series, the BSN for Master's and Doctorate, the American Academy of Preceptor Advancement. We've looked at that website. We've described the roles and responsibilities and relationships necessary for a dynamic preceptor-preceptee and faculty partnership, including all of the roles: a teacher-coach, leader-influencer, facilitator, socialization specialist, role model protector, evaluator, feedback provider. And we've started the process of identifying coaching strategies that inspire growth and development of the preceptee. So in the blog, and what will happen now, we're at the end of this webinar, here are some examples of some discussion that we could have. In your role of coach, give examples of strategies that you use to inspire a preceptee. It might be from the reading, it might be from your own experience and that the reading doesn't even address. So, I'm so excited that because I know many of you are experienced at precepting, but I think the more we share together, how does this go and what is the best approach, the more we'll all learn. You might discuss the challenges and rewards of serving as a preceptor. What is the best part? What is the most challenging part? Describe the value of the documents we've talked about that Ulrich has pulled out and really very carefully laid out in tables 1.1 through 1.4. And how does this help enhance your practice and also your role? And then identify ways of improving the effectiveness of preceptor-preceptee faculty triad. So although we don't have a link right here for you to evaluate Module 1, what we will be doing is you will receive a message, an email, that will have a link and will give you the opportunity to provide feedback on this module. And also that is how we know that you've completed your reading and you've done this module. And then we will provide your name and the information that is necessary, your email address, to the Montana Nurses Association so you can be given credit for this webinar. So with that, that's the end of webinar number 1, Module 1. We thank you for joining us, and we look forward to hopefully meeting some of you in the near future. Thank you.